Assalamu alaikum. This is Amina with New Wave Global. Today, my guest is a 38-year-old Pakistani-American born and raised in New Jersey, now living in Arkansas. He's a practicing double board certified physician in internal medicine in pediatrics. He has worked with various non-governmental organizations for medical mission work, primarily organized to help refugee groups, including Syrian refugees, Venezuelan economic refugees, the Rohingya, and Palestinians. He recently visited Gaza with MedGlobal for a little over a 3 weeks period in June and July of this year, and was stationed at the Aqsa Shohada Hospital in middle area of the Gaza Strip. Thank you and welcome, Dr. Ahmad Yousaf. Thank you for taking the time out to talk with me.
Thank you so much for having me.
Of course. So you were recently at the literally only functioning hospital in Gaza. Can you tell us about your experience over there? Just walk us through your day at the hospital over there.
Yeah, so when I was there, there was, in the 20 number of hospitals in Gaza before this, massacre started. And at the time I was there was 3 left functioning. There was Nasser Hospital, which was a relatively large hospital. And there was Adwan Hospital, and there was Aqsa Shohada Hospital. Aqsa Shohada Hospital was actually primarily an OBGYN, gynecology, and baby delivery place. That's what it was for before this conflict started, and it has since, like every hospital in Gaza, became a trauma center essentially because that's all they could handle, and there weren't any more hospitals left, so everybody became the same thing. And so the physicians that I went with, I went with a group called Med Global. Our plan was to have about 8 doctors go with us all together on the mission trip. Over time, because of the way that Israel and the IDF, who's allowed into Gaza, kept changing the entry dates. They required essentially 3 to 4 week commitments of time, and they would be the ones to allow you in via a bus drive through Jordan and the occupied West Bank. And into Gaza, and what they kept doing, definitely by design, is they kept changing the date of entry. So they would say, you're going in May 15th. And so I thought I was going May 15th, and then it was June 14th, and then June 18th, and June 22nd. And you could imagine if you have a normal job,
Yeah.
taking a month off and then shifting it constantly was almost impossible. And so every doctor that was with me on the trip planning had to drop out. And so alhamdulillah, because of some fortunate situations in my personal life where I can modify my schedule a little bit easier, I was able to continue the commitment to go. And so I went with this group by myself. I was supposed to go with 8, and I was by myself on the trip from Jordan. There was 24 other humanitarian aid workers on the bus that we entered with, about 4 physicians total, and then about 21 others. I was the only one going to Aqsa Shohada from this group. And when I got to that hospital, there's a lot to talk about when entering and some of the other things that are really obvious, but I'll save that for a little later. But when we got to the hospital, we realized really quickly that the most useful thing that I could probably do as a doctor had nothing to do with being a doctor. It had to do with just being present, because Israel and the IDF knew exactly where we were at all times, probably because of my phone, and also because they required mandatory reporting by each NGO where every single international was. We realized that the most valuable thing we could do is stay in the hospital, because they probably wouldn't want to kill an American. Right? They don't care about the people there. They devalue their blood and their lives pretty significantly. But for us, the blue passport kind of provided some type of protection, and obviously. And so we realized if we just stay there, we're all going to sleep in the hospital. So the doctors all slept in the hospital. We all stayed in the building because we never wanted to leave, because we knew what it meant to leave. And we would wake up in the morning, or whatever the morning looked like. There is a constant humming of drones above your head 24/7 the entire time you're there. Those are surveillance drones and attack drones. They're quite high in the sky, but you can see them circling constantly all day. The humming sounds like a lawnmower from like your neighbor. You can imagine if you're outside and you just hear a lawnmower going for your neighbor's yard, just all day. And the only times they silenced was when an attack was coming. So often the silence was accompanied with a very eerie feeling from everybody, because they knew that usually when F-16s or something else was coming behind them to drop something somewhere close. About 2 or 3 times a day, we would hear a lot of attacks, explosions around us. Not so close to me that I was ever in danger, truthfully, while I was there, thank goodness, but close enough that the ground shook and the building shook, and it kind of most of the days felt like kind of thunder, that feeling that you get when there's a thunderstorm and the thunder is somewhere close. And that was usually after Fajr time, for some reason, that was the time they chose to begin bombarding whatever they were going to bombard. And then sometimes after Dhuhr time, give or take. And the days were like this. We had tons of patients in the ER and tons of patients in the hospital laying out with their families in tents all within the hospital. So the hospital was meant for 200 people. There were 700 people in the building at all times, because when a patient came their family also, and they knew the hospital was probably safe and indoors. And though there was no ventilation or anything like that, it was still better than being outside in the heater in the tents in 120-degree weather, right? And within the tents without ventilation. And so families would stay with their sick or injured family members, and we'd see those patients, try to manage them. And then, once a day or twice a day, there was a mass casualty event. When we heard a bombing go off close enough, we knew that we were going to get a load of patients to the ER. And they came in all ways. They came, in donkey carts and people's arms, many people per vehicle, many people per ambulance. And they came in, and family members rushed into the ER and threw their family members at us, just hoping we could do something. And unfortunately, most of the time we couldn't really do very much at all for many of them. I think, people who talk to me since I've come back, and now it's been quite a bit of time. It feels like a lifetime ago. Right? It's been 2.5 months or 3 months, 2.5 months since I've come back now. They're like, wow, you did, this thing that sounds brave or whatever, but truthfully, we weren't effective as healthcare providers. We were very minimally effective, and honestly, other than providing a level of moral support, if that's a thing, and again, the protection of the hospital, because there were Americans there, I don't think we were very effective at all in trying to help people medically, and that's because we didn't have anything to help people with.
I was going to ask you, how well equipped do you think this hospital was at that point to deal with these mass casualties, and how much above capacity was it running?
Yeah, it was a 400, 500, 600% capacity, right? There was only 3 ORs in that building before the conflict started. They converted 2 of the delivery rooms, because again, it was an OB/GYN hospital, into operating rooms, but they weren't really operating rooms. They weren't made for it. The ventilation system didn't make sense. That power went out constantly. The bovies, which are the electrical tools, surgeons used to cut, it didn't function half the time. We ran out of oxygen in the ICU often, and they had to be emergently changed out. There was limited oxygen. We were using simple gauze and betadine for most of our wound care, because we didn't have any wound care supplies. We using, it was MacGyver in medicine. We were using the wrong antibiotics, the wrong disease process, because that's all we had available to us. We were extremely limited in our ability to provide analgesia and pain relief. And so we were using ketamine very aggressively, which is not a drug we'd ever use in the context we were using it there, but we had to, because we needed to give these mass casualty patients some type of relief in extremely difficult situations. And so, the supplies there was nothing. I can't imagine now, 2.5 months later, knowing that we left in a situation where there was nothing to begin with. Those shelves were almost empty already, and there's been no allowance of humanitarian aid in from a medical supply perspective since I've left. And so I know the situation is more dire based upon the communications from the people that I know that are still there.
And my understanding is that it wasn't that if you weren't equipped to deal with a certain casualty or morbidity, or the ICU level of care, if you weren't able to provide that, there was no way or nowhere to transfer people to for a higher level of care.
Yeah. The truth is there was no higher level of care. That's just the truth. There was no way to get them out. People died on the floor, right? That's what happened when they weren't able to get taken care of because the situation was overwhelmed. We didn't have a tube to intubate them with, or we didn't have a machine to put them on. There were many days where 5 kids would come in simultaneously, and we had to intubate 1 or 2 and knew that we couldn't intubate the others. And we had to choose between who was going to get the device to live and who wasn't, based upon the severity of the injuries we thought we couldn't treat otherwise. And so if somebody came in with a head injury and we didn't have neurosurgery available to manage them, we knew they were going to die regardless of whether we put a tube in to breathe for them. And so we'd often triage and save that for a patient who we thought we could save with the other stuff that we had available to us. So that was a day in, day out unfortunate reality there.
So there was a constant triage process going on, right?
Yeah. Every day, SubhanAllah, when I think about it from, I did it for 3 weeks, right? 3 weeks and a little bit. The Gazan doctors have been doing that for a year. It's when we talk about the impact it had on, like, medicine in America, we talk about moral injury and burnout. It's a joke compared to what those doctors have experienced there, and nurses and healthcare workers all together, because not only have they had to, these are their families. Literally, the bombs went off, and the first question they would ask is, hey, which neighborhood was that bomb? Because maybe it was my family, right? So that's the first thing that's going on. They don't know if their own families are being killed in the moment, and then they're bringing in their neighbors and their family members into the hospital trying to care for them, and then they know they don't have the supplies to take care of them, and they have to triage between people who they don't think they would survive regardless of what they do. And they have to do that every day for a year, and it doesn't get any better. And then beyond that, their life is always constantly under threat. And especially with the IDF policies that kind of existed for last year, healthcare workers aren't just a random act of violence or casualty. It's a purposeful attack on the healthcare system and healthcare workers. Right? People in scrubs were attacked on purpose, and so we heard that from many of the doctors that had been repeatedly moved over and over and over again, kind of relocated as the IDF came from the north down to the south. And they said they didn't just like leave us. They specifically came after the healthcare workers. They detained, arrested, tortured, and killed healthcare workers on purpose. And so that level of stress for that group of people it's unbelievable, because the level of stress that the average international doctor experienced was quite high. But our lives were never in danger. That's just the truth. We realized really quickly we were safe, in the grand scheme of things, as safe as you could be in that environment. But these others that were around us, shoulder to shoulder with us, they're the ones that were constantly in danger. Their families were in danger because of what they were doing, right? And that's a scary thing to think about.
So you and the other healthcare workers who have visited the area are also serving as journalists for the area, are the ones who are actually bringing back the story, because there's absolutely no access to real journalists to that area. So do you think that the death toll is being underestimated? Because we don't really have any real numbers.
So so I have many thoughts on that question. It's a really good question because it addresses like three different really important things. One is um, there is no CNN or Fox News or BBC on the ground, and that's by design, because the people limiting their access is the IDF. There's no doubt, there's no question or concern, there's no doubt about this on the ground. Who's being limited and what's being allowed to get in and get out is 100% in the control of the IDF and the Kogat, which is the governmental branch of the Israeli government that controls foreign movement within the Gaza Strip. And they completely have disallowed any access from foreign journalists. In fact, even for like independent journalists, I don't want to be a journalist, but I went to go document. That's one of the things I went to go do. I couldn't take an extra phone in because it may be an extra video camera. I couldn't take a GoPro in. I was limited on my ability to take a camera, so don't take a camera. I was limited from those type of supplies because they didn't want documentation. And I mean, the reason is, like, this is really important, is because it's obvious. Like, it doesn't require complex thinking when you go in there and you see what's happening. If a lay person with a video camera walked in there and videotaped what was happening as a third-party observer, there's only one thing that can be concluded, which is these people are committing war crimes and genocide against the Palestinian people. There's no other explanation for the level and extent of the carnage and devastation. There's no explanation for the level of the evil inflicted upon those people that are obviously innocent, children and women and unarmed men and elderly people. It didn't matter. It was indiscriminate murdering and killing. And if video cameras were allowed in, it would be like lifting the veil off of a concealed secret. It's the worst concealed secret in the world, just because cameras aren't allowed in. And so I never want to be a journalist. I'm a doctor. I stink at journalism, right? I'm good at medicine and good at ICU care. But every doctor realized really quickly, right, the two things that we were going to do most beneficially was be present so that we could protect people because they were scared of hurting us from a narrative perspective as Americans. And the second thing was documenting as much as we possibly could and sharing with the rest of the world what we saw as eyewitnesses. And for me as a Muslim, I witnessed it in this dunya and for the akhirah both, right? Like a feeling that I have, it's a strange feeling I thought I would never have. I've been a lot of other places, right? We'll talk about that, I guess, too, right? There's nothing like this experience in terms of what the people have experienced, not just in hardship, but in the purposeful targeting of the most vulnerable portions of the population. And so and they're special people. Every group of people is special, but the people of Gaza are definitely special. And I felt that multiple times while I was there. And there is no greater honor to me in my dunya or akhirah today where I live based on my experience. And I think every doctor, especially the Muslim crowd who had gone, will say the same thing, is that, my hope is that I can be a witness for them on the day of judgment of what they've experienced and what the evil was perpetrated against them in front of Allah Ta'ala, because that's definitely an important part of this for me now that I've experienced it. It wasn't what I went with. That wasn't my intention was to go be a doctor and go help, show some support. I knew it was a calling to try to do those things like many other medical missions, but this ended up being very different than I expected.
So you're also one of the physicians who was part of the physician group that wrote a letter to the president describing the situation. Do you think that has gone anywhere? Is anyone paying attention to it?
And, even this type of thing and even this interview, right? Or even the next talk I'm going to do in 2 days in New Jersey while I'm there for an event or whatever, the college campus event that's happening next week, or those letters that we sign, or the UN requested resolutions where they want physicians to document what they saw. And maybe this is it's partially due to my belief thought process, right? As a Muslim and where I am in my head right now after this experience. I used to be quite exasperated, right? Before I went on this trip, I'd be exasperated. I'd say, like, man, we can't convince I live in Arkansas, right? I'm surrounded by MAGA hat wearing people who think a very specific way and have never been exposed to the outside world and had a very specific, narrow view of the Israeli-Palestinian conflict, mostly to support Israel because they must be the good guys because they're the only true democracy, right? That's the classic tagline here. And it used to just drive me crazy. I used to watch Instagram videos like everybody else did for the last year and cry with my wife, like I'm sure everybody else did before they went to bed at night, trying to figure out how to help or be useful or, just feel desperate and lonely in our inability to do things effectively. And now I feel quite different about it. The reason I feel that letter, and this is going to sound, silly and maybe a little crass. I don't give a crap about whether or not Joe Biden reads my letter or it affects his heart or his mind. The only people that I care about in the dunya sense, right, beyond doing things for Allah Ta'ala is I just want to make sure the Gaza people know that we're doing the work. That's all I care about now. And this is, even this interview, I don't know who the audience is. I have no idea who they are, right? Inshallah, they're people whose hearts and minds are affected by information. But regardless of that, the only people I care about hearing that I spent time and energy and effort are the people that were shoulder to shoulder with me in the hospital, who I saw. I got to leave. I got to go back to my family and air conditioning and eat whatever the heck I want from DoorDash and not think about my kids being in danger constantly and all these terrible things. And they're still there. They're still there experiencing the worst of humanity. And I anything I do from now on for the rest of my life probably will be, and definitely as long as this goes on, will be ensuring they know that I'll never shut up about what kind of people they were and what they're experiencing. And so I don't think that the letter we wrote to Joe Biden was particularly effective. I think it did raise awareness in certain crowds, hopefully the medical community at the very least. I'll still sign every single one of them and put my name to it every single time. And again, as a witness in this dunya and the akhirah, do that. But I don't think that you can change the mind of people who already know. And I think Joe Biden and Kamala Harris and the entire Democratic Party, they know quite well, just as much as the Republicans do. One thing, so I'm just telling you who I am. I was born and raised in New Jersey. My parents are both from Lahore, Sheikhupura in Pakistan. And I grew up a very Americanized Pakistani kid, right? When I was in Gaza, when people say, hey, where are you from? I didn't want to say America because I was ashamed, okay? My whole life, I would kind of say I was American. So if somebody on the street here in Arkansas, hey, where are you from? I say, I'm from New Jersey. Right? Why are you asking that question? Yeah. It's kind of a natural response. And then they say, no, where are you really from or whatever? And I would say Pakistan. But when I was there, I would jump to Pakistan. I would say, I'm Pakistan, I'm Pakistani. Because that's what they meant anyway. They knew by my accent I was American, probably, or Canadian or something, but they wanted to know where I was from ethnically. And I would say, my parents are from Pakistan. And they would give me a hug every single time. Every single Ghazni would give me this a big hug, right? So it just made me think of somebody specifically, this random guy that we were literally buying a water bottle. And when he literally came around the thing to give me a hug. I said, why do they like Pakistani so much? He said, because when 2005 happened and they closed the borders and the people of Gaza didn't have papers, they don't have any way to immigrate because they don't have passports or any documentation. Pakistan opened up its borders to the medical students especially, but many students to give them special visas for Gaza. And so I met Gazan people who speak Urdu better than I do, right? Because they went and studied in medical school for 7, 8 years in Pakistan, Karachi, and stuff like that, and would come back to Gaza because it was one of the few places they were allowed to go because the Pakistani government opened up a certain number of visas, during the prior era of the government in Pakistan. And so I called my mom. I actually messaged my mom on WhatsApp while I was there. I said, "Ma," because she's Pakistani, obviously, and I've never really shown my Pakistani love, let's say. But I told her, I said, this is the most proud I've ever been, of being Pakistani. I always tell people that. When people say, where are you from? I say, I'm Pakistani. I'm Pakistani. Pakistan. We did this thing really right. So it was a cool thing, especially in the context of the Gazan people. Uh, they feel betrayed by so many of the Arab countries.
Yeah.
And we know it's not the Arab people, it's the countries, the governments. That's what we mean, right? These institutions, but still, they feel this feeling like they forgot us, they don't take care of us, they're not willing to fight for us. But man, when you say you're Pakistani, their eyes light up because they say, well, those people, we know those people are our people. They're far away, right? They're further away, and they maybe can't help in the way they want, but they always took us in. So I think that's a really cool, kind of proud to be Pakistani moment for me. Yeah.
That's really heartwarming, and I'm sure not a lot of Pakistanis know this. So thanks for sharing that.
Yeah.
So, and you mentioned earlier while we were talking that you have been to other conflict zones too. How do you compare your current experience in Gaza to your prior experiences in other conflict zones?
So I've been about 10 other medical missions over the course of my career, right? And I've been to some that were like kind of clinic work in Ghana and Haiti, right? And then I've been on refugee specific work like the economic refugees from Venezuela into Colombia and the Rohingya and multiple for the Syrian refugee groups during that conflict, which continues to be a thing. And what I'll say is those experiences left me impacted greatly by the humanity I saw in the people, the perseverance of people, the faith people have, all the things you'd expect on those kind of things where you get to see people who persevere through really difficult circumstances and really show beautiful qualities despite those things and overcome. This was a million times worse than any other one I've experienced in terms of what the people are going through, which is I don't say that lightly because I know the Syrian refugees and Rohingya people have gone through immense, ridiculous violence and tragedy. But Palestine and the Gazans specifically amongst that group have experienced this over a length of time, which is particularly unique, and a severity which has been prolonged, and the level of technological warfare that's layered, right? So it's not just the restriction of food and water and calorie counting before October 7th, but it's the constant surveillance, the average age of Gaza being 14 years old, right? Children, right? Like the vast majority of 50% of the population of Gaza is under the age of 14, right? These are ridiculous numbers. These are children that we dealt with. The adults in the room were 30 years old, right? That's what it felt like. When you look in a room and you see the adults, we're talking about 30-year-olds, we're not talking about 50-year-olds. You don't see those it's a different world in Gaza. And just with that was beyond the absolute destruction and violence that was just, those terrible Twitter/X videos you scroll through really quickly because you're scared to see a headless child or amputated whatever that we've seen in the burned patients that we saw the last couple of days in the tents, that we scroll back quickly because our hearts can't handle it, right? I think everybody does that now, almost reflexively. It does nothing to really articulate how bad it is on the ground. Everything that you think it is, it's much worse. And we saw that over, and every doctor that I was with said the same thing. We all thought we were mentally prepared as much as it could be, obviously, within that environment, but because we'd seen so much imagery from TikTok and Instagram and Twitter, but nothing could have prepared me for the amount of just violence and carnage. It was a surreal experience in that regard. And because of that, though, the other side of that is, the people of Gaza are they're chosen people. There's just no doubt. You sit in a room with these people, young men and women. I sat with these, I would teach the 6th-year medical students that were coming to the hospital during a war. They'd have to cross over the red zone, which was open kind of season on people. If you cross the red zone, essentially the IDF is saying we can kill you if you walk through the street during the red zone. These girls would, 21-year-old, 22-year-olds, right? Girls would cross through the red zone just to come to the hospital so they could help a little bit and so they could learn. And they would sit with me and we'd sit and go over, a topic like pneumonia or whatever medical topic that they wanted to learn about that day. And they would take notes. They know the information really well, like better than most of the Mexicans I've seen here. And their level of just courage and bravery and dignity. One girl named Lena, when I recently asked her, a month or two ago, I said, hey, share some pictures of your group because I want to share them with others with us. And she said, listen, I'm only going to share the pictures where we look strong and happy because I don't want to share the pictures where anybody could think that we deserve pity because we're not those people. And she says, we do feel that way. We do have days where we cry every day and we're broken and we're experiencing it. But I don't want to share those pictures with people. That's not what I'm interested in. And that's the kind of people, the level of dignity in Gaza is, it's changed my thought process on what people can be.
So, and what do you want the world to know about the Gazans?
When I ask them what do we do, right? What can I do as a Muslim leaving Gaza, as a doctor, as a human being leaving Gaza and knowing what I know now? They just don't want us to forget that they're there. They know that the average American Muslim guy or gal probably isn't going to be able to change Joe Biden's mind, right? And the infrastructure around the military industrial complex is a certain way that, a few individuals probably aren't going to have a tremendous impact on the way things are going in the war as it stands today, right? But that's not what they were asking of me to do. They weren't saying, why don't you do X, right? They would say things like, the Arab governments, how dare they do this? The other Muslim governments, why aren't they helping us? Of course. But for us, for every single individual who's out here thinking about them, and it's just remembering that what they want to feel and hear is that they are thought about, heard, loved, and cared about in the way that they deserve. And there have been no more deserving people in my life of that level of energy and love and thinking, even if it's only is all we can do, then we do it. And we don't shut up. Here's the thing I'll conclude with from my perspective of what the action item is for me going forward for the rest of my life. Mm-hmm. I will no longer disclaimer the way I talk about Palestine and Gaza. I will not have to, I do not need to disclaimer my thoughts on who the good guys and the bad guys are, where the evil is coming from, that the IDF is committing genocide in the context of occupation and apartheid. Those words shouldn't scare us. We shouldn't feel, I don't want somebody to get their feelings hurt. Their feelings hurt mean nothing to me anymore. People's feelings hurt in the States mean nothing to me. The debate about what this is only exists in places like this where we're privileged enough to have the time to think about it. The debate on the ground with all the 100% of the humanitarian aid workers on the ground, no matter where they came from, Australia, Europe, right? There was English people, there was Dutch people, everybody, Italians, Americans, Canadians, every international aid worker on those buses that I went in and went out with and everybody interacted with, there was no debate. There was 100% consensus what was happening. There wasn't a worker, an individual third-party observer who came into that place and said, it's a complicated problem. No, there was no complication. It was obvious who was committing absolute travesty, war crimes, and genocide, and who the people that were showing light and goodness and fight and perseverance and resistance. And there was no debate about it on the ground. Nobody should feel ashamed anymore about taking a side here. Take the side, take the right side, and be proud and brave that that's what you do.
Thank you, Dr. Yousaf, for sharing your experience with us.